name is Katie Dively, and I work at the Center for Health and Safety Culture at Montana State University. Today we're going to be engaging in a webinar on social norms communication. So as I mentioned earlier, we will be actually recording this webinar for future play on our website. So we do appreciate minimizing the background noise. You can either mute your phone by pressing a mute button, or you can press *6 to mute yourself. Please do that so we get a sound recording at the end. You may get a little message from us if there is background noise, and so please just mute yourself. Well, again, we thank you for joining us on this Wednesday afternoon. Let's get started talking about our agency just for a minute here before we go into social norms communication. So we are an interdisciplinary center that serves communities and organizations through research, training, and guidance to cultivate healthy and safe cultures. So that's a mouthful. What does it really mean? It means that we're a team that comes together from a multitude of backgrounds, a wide variety of backgrounds, and our goal is to serve communities and organizations by providing them information from the research that we have done in partnership with communities and in partnership with other organizations. So we want to get that information out, and we do that through training like this, through webinars, and also through a guide service that we walk right alongside a community or an organization as they implement the work, ultimately to cultivate healthy and safe cultures. This is a map of our projects that we have engaged in the past or are currently engaging in. You are welcome to go to our website, which is at the bottom of the screen, and you can click on, this is an interactive map, you can click on any of these bubbles, and you can find out what that project was about, the years that that project lasted, and just find out a little bit more about it. So you are welcome to do that. If you see a bubble in your area, you can check in with those folks and ensure that, that you have an opportunity to chat with them. The purpose of today's webinar is to learn about communication, and in particular, social norms campaigns as a way to improve health and safety in our community. I wanted to start first with just a very high-level sort of picture or overview of our larger framework. The Center for Health and Safety Culture operates out of the Positive Culture Framework. So all of our projects, all of our efforts come from this framework. The reason I bring it up is that communication is a very important part of our framework, and that's what we're going to be going into depth on today. So if you are interested in learning about the framework, you can certainly go to our website. You can certainly attend one of our trainings. But today we're just going to be speaking about one aspect, one important skill, which is communication. One thing that I do want to point out is that this is an appreciative model, and you can see that with that green arrow. It's pointing in an upward direction. We are trying to grow health and safety. We are trying to grow protection. We are trying to grow health and positive behaviors in communities. And if folks wouldn't mind muting their phones, we can't hear you, so please do press *6 to mute your phones or press the mute button. Thank you.
Hey, Katie, I believe your slides lost connection to WebEx.
Oh, that's not good. Let's try that again then. Are you able to see the slides now?
I am not, but let's give it just a second.
Neither am I. Can you hear me? This is Peggy Joe out of Grand Forks, North Dakota.
We can. Thanks, Peggy. Let's try to share. Sorry about that.
Here we go. It's loading.
There we go.
All right, let me go back a slide. This will make a little bit more sense now that you can see something. Thank you for chiming in. So this is the larger framework, the Positive Culture Framework that our organization works from. As I mentioned, today we're going to be focusing in on just one important aspect of the framework, which is communication, a very important skill that we grow and seek to grow within leaders and communities, because I doubt that there's any prevention initiative or strategy that doesn't involve some sort of communication. So I mentioned that this is an appreciative model. We look at growing protection. We look at improving health and safety rather than looking at it as always decreasing something or stopping or preventing a behavior. We want to talk about how we're growing protection, how we're growing healthy behaviors and attitudes. I am not going to make you a master at this model, but hopefully give you a high-level overview so that you can be effective in communicating, because that's what we're here to do, right? If we are truly here to improve health and safety in our communities, we want to be effective. We don't want to just be busy and waste our time. So today we do want to talk about how to engage in effective communication, because unfortunately a lot of communication campaigns are ineffective, and we don't want to be that way. So we know that if folks would please mute their phones, thank you. So we know that communication campaigns, when coupled with other strategies, are effective. Also, communication campaigns that attain adequate audience exposure or dosage. So these are two things that we really want to keep in mind as we move forward with communication campaigns. We always wanted to be doing our prevention strategies in concert with other strategies, and particularly for campaigns, we want to be sure that we're attaining adequate audience exposure. Also, successful campaigns need to be theory-based. They have to have a good theoretical background and science to them. And we need to continue to evaluate, are we getting that exposure or that dosage that we need in order to be effective? We'll talk about what that means in a little bit. Ultimately, we're here to shift behaviors, right? To grow more protective behaviors, more healthy behaviors. But let's talk about what drives behavior. This is an incredibly simplified behavior model. I'll show you quickly the larger model that this is derived from in a bit, but I think our focus should just be on the simplified model today. We know that if somebody is willing or has the intention to engage in a behavior, they're more likely to engage in that behavior. But what drives somebody's willingness or the intention to engage in a behavior? We know that that's their attitudes and beliefs. If they have favorable attitudes or beliefs about the behavior, they're more likely to be willing to engage in that behavior, right? The opposite is also true. If they have negative beliefs or unfavorable beliefs or negative expectancies about the behavior, they're less likely to engage in that behavior. This becomes really important for us. So where are our attitudes and beliefs coming from? Well, we know that these are coming from our value system, our values, our community values, our family values. Now, values are quite broad. They aren't tied to a specific behavior like attitudes and beliefs are, but they really provide the foundation that helps form our attitudes and beliefs and whether or not they are more health-focused or health-minded. So this really becomes the basis and the focus of our effort and of our communication. If we know that attitudes and beliefs are really driving these behaviors, let's think about those as we engage in communications. There are different types of beliefs. So unfortunately, it's not a one-size-fits-all. We can't just engage in one belief and changing one belief in order to solve our issues. It's a variety of beliefs that we want to take into consideration. So let's talk about what those beliefs are. There are behavioral beliefs. Behavioral beliefs are expectations about engaging in a behavior that inform our attitudes. So, as an example here related to underage drinking, I can dance better when I drink. That's a positive expectancy, a favorable outcome or belief about drinking, which would make them more likely to engage in that behavior. For example, a negative expectancy might be that I get sick when I drink. So you can see how that negative belief might make them less likely to engage in that behavior. So those are behavioral beliefs. Normative beliefs, which we're focusing in on today, are an individual's general perception of what is common or expected about a behavior. For example, if somebody believes most students in my school drink, they're more likely to engage in that behavior. But the opposite is also true. If they do not believe that that's the norm in their school, they're less likely to engage in that behavior. Lastly, control beliefs are an individual's perception of their ability to engage or even not engage in a behavior. So as an example, if I wanted to, I could go to a party and not drink. So this is important. This is about their skills. It's not just about their skills, it's also about their comfort level and their confidence. So they might be able to say that they don't want to have a drink, but they might not be comfortable in doing that. And that definitely plays into whether or not they are going to engage in that behavior. So again, today we're going to be focusing in on the normative beliefs. Here is that larger behavior model that I spoke about. You can see in green that behavioral beliefs, normative beliefs, and control beliefs are outlined here. And today's focus comes from normative beliefs. Remember I said earlier that our communications need to be grounded in good science and a good theoretical framework. Normative theories is what social norms communication is built from. Normative theories suggest that we tend to do what we think most others are doing, or we tend to believe what we think most other people are believing. But unfortunately, we're often wrong. We often have a misperception about what most other people are doing or what most other people are believing. Let's get a couple of terms clarified before we move any further. There's the actual norm, which is the actual behavior of the majority of the population. It is what most people do. And we can gather this information perhaps on a survey by asking, how often do you engage in X, Y, Z behavior? Or how often do you smoke, like it's written on the screen? That would give us the actual norm. Now that's different than the perceived norm. The perceived norm is the perceived behavior of most people. It's what we think most people do or expect us to do. This is what we think is happening. So we could add a matched perception question to say, how often do most students in your school smoke? So we've asked them about their actual norm, their actual behavior. How often do you smoke? Now to capture that perceived norm, we're going to say, okay, well now how often do most students in your school smoke? And often between the two of these, there's a gap. We often overestimate risk behavior of our peers, and we tend to underestimate protective behaviors by our peers. So protective behaviors like wearing a helmet, wearing a seatbelt, engaging in screenings, preventative screenings. And that's important, and it matters, and it impacts our behavior when we have this gap between actual norms and what our perception is out in the community. So let's talk about why this matters. Well, from our work with other communities and other organizations, we've asked these questions. We've defined what the actual norm is and asked what the perceived norm is. What we found in Oregon was that students who misperceived monthly drinking among their peers were 6 times more likely to drink monthly, and actually 9 times more likely to binge drink. So again, those students that had a misperception, that overestimated their peers' use, were 6 times more likely to 6 times more likely to drink monthly, and 9 times more likely to binge drink. This is a risk ratio. A Utah survey, adults who perceive that most people wear their seatbelt less than half the time were 9 times more likely to also wear their seatbelt less than half the time. And lastly, one more. This comes from Minnesota. Adults who perceived that most perceived half the time or more were 10 times more likely to also be speeding half the time or more. So you can see that perception makes a difference. What we believe to be real, what our perception of reality is real for us. It doesn't matter if it's accurate or not. It is true for us. And we need to pay attention to that because that influences behaviors, right? Because that's a normative belief. There are 2 types of normative beliefs that I want to discuss today because these are important when we get to messaging. So there are, again, normative beliefs being beliefs about others, what's expected, what is common. There are injunctive norms, and these are expectations. Do most people important to me think I should or should not do this? Right? Do I think my parents think I should do this? Do I think my best friends think that I should engage in this behavior or not engage in this behavior? So that's very important. Injunctive norms are very important when predicting behavior. as our descriptive norms, which describe the behavior. So do most others do this? So I can have a belief that I think most others are engaging in a behavior. That would be a descriptive norm. The injunctive, again, is your expectations. What do I think others are thinking about what I should or should not do? Again, there's no one-size-fits-all either for messaging, right? Just like there's no one-size-fits-all strategy, there's no one-size-fits-all messaging, meaning that first we want to determine what is the behavior we're trying to grow in these different audiences. What do I want from parents? What do I want from schools? You know, what are those misperceptions? What are the misperceptions among law enforcement that we need to clarify? So for parents, if you've collected the data and you're trying to get them to not be providing alcohol to youth, we might be able to state a message from our findings that most parents do not allow their children to drink. If we're trying to implement curricula in schools, we might be able to say something like most schools provide evidence-based curricula. And with law enforcement, if we're trying to get them to engage in more source investigations, and we've done an assessment of law enforcement agencies, we might be able to say most law enforcement conduct source investigations. Again, different norms for different audiences because we want different behaviors from each of them. So it's important to start to think about where do we get these misperceptions? We all have them. Parents have them. Schools have them. Law enforcement have them. Youth have misperceptions. Where do they come from? This is a great thing to brainstorm as a coalition. It's a great thing to brainstorm with a bunch of youth because we can come up with all sorts of ideas of where we're generating these misbeliefs. So news, if we just take one of them out there, we know that news is reporting non-norms, right? If they were to provide us information with only the norms, probably nobody would watch, right? But they are presenting unnormal or non-normal information to us. That's what news is. But it's interesting because today we see the news often throughout the day, and then we get it on our social media, right? So we might be seeing that one not normal activity restated 15 times, and that might change our beliefs. It might lead us to conclude that these behaviors are more prevalent than they really are. We can get it from TV, from music lyrics, from powerful voices that we trust perhaps, from celebrities, from community leaders, and unfortunately, sometimes from us unintentionally. So it's important for us to start to check our language. How are we describing the issue? How are we talking about this in our communities? And are we accidentally leading people to think that it's more common than it is? So ultimately, what we want to do with our communications is clarify norms, allow people to see what the common healthy behaviors and attitudes are so they can move in that direction themselves, so we can grow that number of people engaging in those positive, healthy behaviors. This is where communication comes in. Why do we communicate? For a multitude of reasons, but ultimately we're trying to close some sort of gap that has been illustrated in our data. Maybe that's a gap in knowledge. People simply do not know. Maybe it's a gap in skills. They simply do not know how to say no, or they don't know how to do something. Maybe it's a gap in misperception, right, or a gap in perception, the normative gap, which we're focusing in on today. But we communicate to close those gaps. We might also communicate to motivate other prevention strategies, right? We know that we need a variety of prevention strategies.
Ms. Mayhill, please leave a message and I'll return your call.
Communication can help us
at the tone.
do that.
Please record your message.
Communication can actually foster engagement and foster the conversations in a community that might lead to other prevention strategies. And lastly, communication provides us with an opportunity to tell a new story in our communities. And I think it's important for us as coalition leaders and coalition members to really ask ourselves this question: what is the story that we want to be able to tell at the end of the day, at the end of our work? And how do I set myself up now to be able to tell that story? So again, just to focus in on where we are today, we are talking about that critical skill of communication. Where does it fall in our framework? It is that skill, and we do have a separate 7-step process that allows us to engage in effective prevention, in effective communication. Again, this isn't about just putting up some messaging or some posters that we think people need to hear. It's about seeking to close the gaps. So let's talk about each one of these 7 steps in this model. Step 1 is planning and environmental advocacy. This is a stage that a lot of communities are in for a year, maybe even more. This is an incredibly important step because it lays the foundation and the work for you to be able to do all the other steps. This is where we identify the issue that we're seeking to address and the focus audience, right? How are we going to narrow down so that we can be effective with the resources that we have? So we identify that issue and that focus audience. And then we have to get access to that focus audience, right? So this can sometimes take a while because we need access for the collection of baseline data, right? How easy is it to go into a school and get every student maybe a survey? That can take a lot of advocacy, so that takes time. We also want to get access to our focus audience for pilot testing. Down the road, we are going to want to see if they understand our messages, if they're attracted to our messages, and that comes from pilot testing. We also want to have access to our audience for evaluation, right? We want to check in. How often are they seeing our message? Do I have the right amount of dosage? So advocacy can take a while, but that's a really important part of step 1. We also want to ensure that we have enough resources to do the job well, to engage in these strategies well. Not just money, but people, time, capacity, knowledge. So we want to be sure that we're building that capacity in step 1. This is where we build a coalition. That takes time. It's not only building the coalition and recruiting the stakeholders, but it's building that capacity of the stakeholder to help you do the work so that it's sustainable. This is where we develop a timeline for our efforts to see if we're on track with our efforts, where we develop an evaluation plan to see if we're reaching the goals we had set out to reach to ultimately change behavior. One of the most important parts about step 1 is the development of talking points. Talking points are going to be critical in a communication campaign moving forward. We can develop talking points about who's behind the campaign. So imagine that you have a new campaign rolling out, you've got posters, you've got billboards. You better believe that they're going to spark conversation. So we want people to be ready to guide that conversation, but they need to be prepared. So who's behind the campaign? What is a social norms campaign? Why are we doing this? Why are we only talking about happy things, right, when we have such a serious concern in our community? Did everyone lie on the survey? How was the data collected? These are great things to think about early on so that our stakeholders can be prepared to engage in this conversation when it comes up in the community, because it will. Moving to step 2 is the collection of that baseline data. Step 2 is incredibly important before moving forward, and it's described well in this quote. All truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. And third, it's accepted as being self-evident. Imagine you're putting up a poster in a high school that's seeking to clarify a misperception about underage drinking. People are going to challenge that message. They better challenge the message. If no one challenges the message, I think you don't have a misperception there. They're not going to believe it. They're going to challenge it because we're sort of shaking their reality. So they're going to ridicule it. They're going to oppose it. So we want to be sure that we are collecting data before we ever put out that messaging, that our data is strong and solid. We have high participation rates, that we're measuring actual and perceived norms to really determine, do we have a misperception that warrants a social norms campaign? Are we measuring both those injunctive norms, those expectations, and also the descriptive norms? Are we measuring campaign awareness? This is going to be really important to our evaluation down the road. Are we measuring how often they're hearing or seeing our campaign? This then leads us to step 3, which is message development. If we're standing on a really solid foundation of data, we can move into that message development phase. I'm going to show you a couple of messages that have come from communities or groups that we've worked with so you can see what messaging in a social norms campaign looks like. This is an Oregon project that we've engaged in. Most Oregon students, 76%, don't drink in a typical month. Here's another. Most Oregon students, 75%, believe it's wrong for someone their age to have 1 or 2 drinks nearly every day. You can probably see, especially with this statement, that they match the survey question very closely because we want to reveal accurate information that's derived directly from the survey. This is an adult message. 77% of us think it's not okay to drink to the point of being out of control. This is a message for law enforcement. Most Oregon adults and parents strongly agree local law enforcement should enforce laws regulating alcohol use by youth under 21. This is an important message for law enforcement, and this is hung in their agency because often they don't feel supported in their efforts to reduce underage drinking. So we want them to know that through the community surveys that adults and parents really did support that enforcement. When we create messaging and we create media, our team relies on this checklist, these principles of effective media. We want the media and the message to be positive. So it's reflecting not only a positive norm, but also reflecting a positive image and behavior on that image. That it's normative, as I mentioned. And maybe I should mention what a norm is. A norm is anything over 50%, so 51% and higher. Is it reflective? Meaning, is the audience or is maybe the picture of the individuals on the print piece reflective of the audience in the community? Is the message reflective of the picture on the print piece, or do they contradict one another? Is it inclusive? Is it made to feel that anybody can be part of that message, or are we leaving somebody out or shaming somebody? We certainly don't want to do that. Also, if you put sponsor agency logos on your pieces, are they a neutral, do people perceive them to be a neutral source of information? So that's important to check out in pilot testing. Is it clear? Can people read it? I mean, as simple as, do I have a clear font that people can read? And lastly, and very importantly, is it database and source specific? Meaning that if we have put a normative stat on that piece, do we have the citation below that describes where that statistic was taken from? This is really important, and it helps build credibility of our effort. So if we've created the media now we need to talk about how are we going to distribute it? How are we going to get it out there to our community? And we want to be very intentional about this in step 4. So there are many, many ways to communicate, right? We could come up with probably 50 ways that people can communicate. Radio, newsletters, emails, posters, billboards, conversations, right? Lots and lots of different ways to communicate. And that becomes overwhelming. But if we start to think about how we're going to lay this out into a communication plan and how often we're going to be doing each of these, that is going to be really helpful. Because we don't want individuals to just see this message once and then walk away. No, it's much more detailed than that. If we're trying to shift behavior, like how many times have you told your children to fold the laundry, how quickly do they do that right after? No, it probably takes a little bit of time, and that's a relatively easy task. So if we're asking somebody to change behaviors and beliefs, we're going to need to tell them over and over again. So let's talk about that dosage. There are 3 components of dosage that we want to be aware of and that we want to be reflected in our plan. There's the reach. The reach is how much of the focus population we're reaching with our message. Are we reaching only 20% of our focus audience? Perhaps our focus audience is high school students. Are we reaching only 20% of them, or are we reaching at least 80%? We want to at least reach 80% of our focus population, hopefully more. Do we want to just reach them once? No. Again, we're going to have to repeat this message in a variety of different ways and many times. So that's the frequency. How often are we getting this message out? So we don't just want 80% of our population to be hearing or seeing that message just once. We want them to be hearing or seeing it every couple of weeks, or to report that they've seen it at least every couple of weeks. And for how long? We typically create communication plans for 1 year at a time. Behavior change takes time. It definitely does. So that's why we want to start to measure process measures like did we implement our communication plan? Are we changing beliefs? And ultimately, are we changing behavior? When we think about communication planning, something that's really important for us is to think about our ability to do this job well. So if you can imagine that your job is to water this field, and this is your resource, we can start to see how we can become a mile wide and an inch deep if we start to put one drop of water over here, another drop of water over there. So it's like thinking about our capacity and our budget, right? Are we effectively able to reach 15 school districts in year one with these messages? Or should I narrow our effort and pour our resources into one area, grow our effectiveness in that area and the capacity of others before we move forward? So starting small is really, we're starting in a way that best uses your resources is incredibly important. And you can plan that out with a communication plan. Now, this is an incredibly simplified communication plan, but it still does the job. So if we have communication plans that list the months and also list the types of communication that you're going to put forward, I think that's a great start. Many communities have used this plan. Many have created their own plans, which have different aspects of them, perhaps who's going to engage in that, who's going to put up those posters, who's going to release that email, and then maybe how expensive it is so you can keep your budget right on here. But again, the whole point of a communication plan is to be intentional about your communication so that we get the dosage that we need in order to be effective. Step 5 is pilot testing. This is really, really important before we go into implementation of our campaign. So let's talk a little bit about pilot testing. So why do we pilot test? Well, we want to be sure that there's contextualization of the message. Does this really connect with them? Is it understood? What is the intent of the message? A great piece that probably wasn't pilot tested? I think we've all had situations like that. So let's talk about understanding and appeal. So we can ask questions of our focus audience like, in your own words, what does this say? To see if they're really getting it. On a scale, how attractive do you find this picture? Attraction is important because that's what, pulls them towards the piece to even read it. So we want it to be attractive and relative to them. Does the picture represent your community? Does it look like it's you? What is the intent? What does this message really mean to you? Say this message in your own words. These are great ways to capture intent and really see if they're understanding it. So now, who do we pilot test with? Stakeholders are incredibly important. We want to test with a multitude of audiences because everybody has misperceptions. So we want to test with our coalition, right? Our coalition is made up of members that might have misperceptions. So we want to pilot test with them. What are they saying? What's the feedback you're hearing from them? School administration, particularly if your focus audience is youth, you'll want to engage in pilot testing with school administration. I've seen too often where they'll go in, where a coalition will go in and hang posters only to be taken down by school administration because they didn't have permission or they didn't have the dress code properly displayed on the media. So we definitely want pilot testing with administration, and that also gives them a heads up about what conversation they might need to guide down the road. Connecting with funders and pilot testing with funders is incredibly important. Their logo, their funds are being used to display this communication, so we absolutely want to check in with them to get their approval. Local leaders are really important as well because they might be getting phone calls about what that billboard's about or what messaging, why this messaging is taking place. And absolutely, we need to pilot test with our focus audience, making sure that they understand it, making sure that it's attractive to them, making sure that the intent is there. How do we do it, though? This is a question that comes up from lots of communities. You can do it in a number of different ways. You can do one-on-one or intercept sampling. So this is often you're in a mall or something like that, and somebody tosses a survey at you and says, hey, can I take 5 minutes of your time? Can you please fill this out? That's called an intercept sampling, where you're intercepting somebody where they are and asking them to provide feedback. It's usually just a little ballot, 1 page, no more, and they hand it back to you for tallying. You can do group testing, focus group testing. Focus groups are where you're getting 8 to 10 individuals, a homogeneous group, meaning that they're like each other, meaning maybe they're all students, or that you haven't mixed students with law enforcement and parents, because we want this to be a really organic conversation for them to provide honest feedback about the piece. And sometimes they aren't able to do that if they're not in a place conducive of having that conversation with like-minded people. You can do interviews as well. This is often done with adults to have a one-on-one conversation, also done with funders quite a bit. Let's talk about this piece. What does it mean to you? How are you interpreting it, etc. People often ask, when do I know I'm done pilot testing? How long do I have to do it, or how many times do I have to do it? Well, really, it's a little bit more of sort of reading what feedback you're getting in. You want to pilot test until you reach a point of saturation, meaning that you're hearing the same thing over and over again. So you continue to do it until you start seeing that pattern develop, and then yep, I need to go back and make it more clear, or I need to go back and make that larger. So you'll start to see how you need to refine that piece, and then you can bring it out again. Now we're ready to implement the campaign. We've pilot tested, we've maybe refined our pieces, and we are ready to go out to the community with our pieces. So this is the time where we really want to prepare for the public's response. The public is going to respond. Our audience is going to say things about our social norms media. If they don't, to me that means one of two things. Either one, they didn't see it, or two, you didn't have a misperception in the first place. Because if you are challenging somebody's assumption of how people operate, they're going to challenge you. So we want to be there with our talking points. That's why we work hard in step 1 to create those talking points, so that everybody's on board saying the same thing. Because that becomes really powerful when we start to think about you saying something, the rest of your stakeholders saying something, maybe the school staff saying that same thing. We want everybody to be on the same page so that message is being reinforced at different levels in the community. We're also listening. We're listening for what messages we might put out next. Our messages are kind of like a conveyor belt. We always have something in development. We always have something in pilot testing. We're always placing something new. So we want to be sure that we're listening. Oh, interesting. Maybe people are talking about drinking and driving quite a bit. Maybe I have some data in my survey that I might want to pull out about drinking and driving. And most importantly, they're hearing and they're steering the conversations. They're putting themselves in a place to hear what people are saying about these pieces and guiding that conversation. Step 7 is about evaluation. Keep in mind that we planned the evaluation in step 1, and we're continually revising and feeding in information that we're learning throughout each of these steps. So process measures are a great thing to start evaluating. Did I implement my communication plan as I intended? Or did life get in the way and I really only did 2 things on that communication plan? If that happens, we know you're not reaching the amount of dosage needed to change beliefs and to change behavior. So the first thing is, did I implement the communication plan as needed? Also, do I need to revise that communication plan next year? Because maybe people didn't hear or see my message. That comes in with campaign awareness, an intermediate variable. How often are people hearing and seeing that message? Where did they see it? Because that helps us to determine what we want to put on next year's communication plan. If nobody heard the Pandora ads, okay, maybe we don't use Pandora next time. Maybe we use local radio, or maybe we don't use radio at all. But it helps us understand what we put into next year's communication plan. Are normative beliefs changing? So campaign awareness will probably shift first, right? You'll see a spike in how often people are hearing or seeing your message. Second, we should see those beliefs change. And then ultimately, we're looking at outcomes, and that's behavior change for what we've selected as our focus behavior. Keep in mind, most most communication campaigns are not effective. So we absolutely want to stick to this process and want to evaluate at every turn so that we know that we're making a difference. We don't want to waste our resources. Another important aspect of evaluation is reflection. I think we get busy. We don't engage in much reflection as a society, but I think it's really important for us. So we want to ask ourselves, what are our most important lessons learned? How will I do this better next time? How has the conversation in my community or among my coalition changed? And you can track that by meeting minutes, by newspaper articles. So it's not just about reflection for yourself, but also of the coalition and the community as a whole. Are we able to pull a group of people together and answer these questions? Keep in mind, it's all about being effective. This was only sort of dipping your toe into what is possible with communications. There is so much more depth behind each of these steps, but we wanted to give you just that intro to communication and that 7-step process. If you are interested in more information, you can certainly touch base with us. I wanted to provide you with just a couple of options of doing that, of connecting with us before we get to the question and answer section. So if you're interested in more information about this communication, building a communication campaign, engaging in that skill of communication, we can certainly do that. So our team often gives short presentations to anybody, really. We give keynote sessions at conferences. We can do one-day overviews of the framework, the entire positive culture framework, how communication can fit into that. Our standard training is a 2.5-day positive culture framework training, but we can also do individual one-day trainings on any of our 3 skills, including leadership, communication, and the integration of prevention strategies. So those are available to you as well. One thing that we've learned over and over again on our team is that we learn best when we're doing something. So communities often tell us too, boy, I went to a training and I got home and I got stuck. I didn't know how to move forward. So this is where we introduce our guide service. So this is available to communities that have engaged in at least a 2-day training. This is one-on-one guidance and coaching as you implement your work, whether that's a campaign, whether that's the larger positive culture framework for improving health. This is monthly phone calls or emails whenever needed. You have your own coach helping you navigate this journey. You have access to a private online community of practice that has other people that are in guide service engaging with, so you can certainly ask questions of them. You have access to our entire team, so you can ask questions of all of us. Remember, we come from a variety of backgrounds, so we often have interesting input. And at the end of our year together, they're year-long contracts, you have an executive summary. And that executive summary captures the successes that you've seen, accomplishments that you've engaged in the last year, but also some recommendations for moving forward. Step 2 can be a tricky part of any normative campaign, and that's a collection of data. We know that survey development is a tricky process, and we leave that to the professionals. It is easy to create a bad survey, so we really want to invest in good survey work. We do have surveys available on a variety of different topic areas. The most surveys that we have are on substance use. So we have them for the youth audience, for parents, for community adults, for healthcare, for school staff, law enforcement, and even alcohol retailers. So you can see how we really hit the different layers of influence across the community, or what we call the social ecology. We have teen dating violence prevention. We have youth surveys for that. And for child maltreatment prevention, we have adult surveys and provider surveys. And then if you're ever interested in researching something, you've got questions about how your community operates or how something is going, how to improve health and safety in some aspect of your organization or your community, just reach out to us, because we are definitely available to talk about that, and we're starting new projects all the time. So please just reach out. Lastly, I want to mention our first ever Center for Health and Safety Culture Symposium that we'll be holding this June in Bozeman. So it'll be June 20th through the 22nd. This is a pretty incredible opportunity to not only learn from experts in the field, but also to share your wisdom. So there'll be opportunities to hear from different presenters in a variety of ways. So they might be a little bit longer, skill-building opportunities within a presentation. There might be a TED Talk short-like presentation just to get your feet wet in a particular topic area. But then there will also be opportunities for you to engage with others and to share your wisdom to improve what we know about health and safety. So it's a really unique opportunity, and we hope that you register on our website for that. So with that, I'm going to turn it over to questions. So you are welcome. Why don't I start first with Anne-Marie. Anne-Marie, did you have any questions that came in that you wanted to share?
I haven't, actually.
Okay. So what about folks on the line? If you want to unmute yourself and ask any questions, we're here to answer them. While you're thinking of your questions, I can tell you that we've gotten about 2 inches of snow while we've been giving this webinar. Beautiful Winter Wonderland. Any questions about communication? Questions about the model? Questions for our team?
Can you hear me, Katie?
Yep, now I can hear you.
Okay. So I did have a question. Have you guys ever done anything like this or used anything at a university? I know you're coming from a university, but actually done anything on a university setting?
So communities that we have worked with, that we provided guide service, have definitely done that in a university setting. We have a couple of universities in Georgia and West Virginia that have engaged in this.
I'm sorry, it's really hard to hear you.
So we definitely have guided communities that have engaged in social norms campaign at a university level. A couple in Georgia, a couple in West Virginia. Soon I'll be training a college in Iowa about this as well. But social norms campaigns are definitely done on college campuses. I will say, though, there is one thing that is common among all of them, and that's a struggle collecting the baseline data. So it is hard to get college students to take surveys, but what success we've seen is that if you can somehow integrate it into a mandatory class, that everybody is taking it during their English class or everybody's taking it during their freshman seminar or something like that, we get much better success with collecting that baseline data. Any other questions? Well, I really appreciate all of your time today. Hopefully this was an opportunity to learn a bit more about communication. If you do have follow-up questions, you are absolutely welcome to ask a question on our website. So please do check out our website and engage with us further. We have other webinars as well that are recorded like today's and are placed under the training section. So if you'd like to jump there and hear any of our other webinars, you're welcome to do so. So with that, I'll sign off. I wish you all a happy holidays and take care. Thank you.
Thanks, everyone. And for the final few people that are sending in questions now, I will be sure to get those answered for you and sent back. If you requested a certificate, that will be emailed to you shortly, as well as a URL where you can watch this webinar in the future. Thank you.